Hi, welcome to the Podiatry Practice Mastery. I've been doing like tons of videos. This is my Tuesday. This is the day I do videos. I did like, I don't know, but there's a new thing I'm doing. If you that are following, it's Podiatry Management Minute. It's with Barry Block. So I record those on Tuesday during my lunch hour. And then I did my YouTube videos. So I recorded 4 videos and I'm doing these. Well, they're shorts now, so they're shorter. Because everyone likes short stuff. This one's not as short because I want to actually give you guys some value and more content. So let's get into it. I had a question of a patient, how to edit my presentation. So I'm going to go over a little bit about that and why you can't edit them. And I'm giving everything away. And so you can, if you want to, you can pay, and I'll teach you how to do that. I did this biopsy student overview, and by the time this goes live, I think my thing for the Podiatry Practice Mastery went live as well. I want to talk about a $4,000 plantar fasciitis patient. So this is something I think you might be interested in. Horses get hoof surgery, so they have a plantar fascial surgery. A veterinarian patient of mine told me about this. And then there's a cool new addition to Athena called pulling of the doctor's notes, which is kind of new. And then I'm going to talk about some that didn't really work with my scribe, kind of what's working, what's not working. I'm a month in, and it's getting really good. It just, I didn't think it would take a month. It did. So let's go into this. First thing is a doctor, they downloaded my presentations, which I call the patient presentation tool. So if you don't have that, you can email and I will send you the link. It's basically practice patientpresentations.com, and you can get a link to this. This is a link. It's called a link tree. So it's basically a web page. It's free. It's called Linktree. And in here, these different links open up different presentations. So my patient presentations, and they are mine. So you're seeing actually how I treat patients, all these conditions, what I show them in the office. And so now it's even getting better with the scribe, because I just have the scribe doing the note, and then I just pull up the presentations and go over it. And then that's about it. But if you don't like the way it is, I'm sorry, but this is the way I do it. If you don't, then you can join Podiatry Practice Mastery Academy. So Practice Mastery Academy, currently it's like under $100 a month. Then you can just join, get all my presentations, and then you can stop. So it's month by month, as long as you need access to it. And you have the 30-day practice blueprint. You have my webinars that I've done, and then all my presentations, which like it's super, super reasonable, I think, especially because one of these presentations just made me like $4,000, and I'll explain that. Okay, so that you can like pay for the whole year. So maybe everyone should just use it for the whole year, or you can use it for free because that's what it's there for. Okay, next one is the student biopsy lab. I did a lab for the students, the residents. What was working was they had good questions. It was fun seeing their questions, what they had, but they, as residents, they don't know what they don't know still. So another cool thing is we can get a sponsor. So there's a pathology lab that sponsored it, which was nice. They like to, buy pig's feet, and they bought us Chipotle, and we had a nice time. I was able to teach them how to do biopsy so I could show them. The technical skill isn't that hard. So the technical skill isn't the most important part. I think it's the practice management part of like when to do it, how to explain it to your patients, how you use it in your practice. So they brought in food, and then I taught how to be efficient. So that's the main thing. I think the main efficiency tool is having a process. So to do it that same day. If they have to come back, they're not going to do it. So same day, which basically is saying, I have my staff, I open up the door, have them say, hey, get me biopsy stuff. So it's 1 cc Elida with epi, inject it, do the biopsy because everything's right in the room. So I have the 2mm punches that I use right in the room, put it in the formalin, and then I have them come in and do the consent. I know it's backwards, but that's kind of the way I do it. And then that's it. And I do it the same day. It takes me like a minute. It's not like ingrown toenails where I do the numbing and then I come back. No, it's like epi, it just numbs it right then. I numb it, take it, and I don't make a big deal. I don't talk a lot about it. I just kind of say, this is what we're going to do. It's going to be simple. It takes about 30 seconds and we're done. Okay. The next here would be this plantar fasciitis patient. This was the patient, the $4,000 patient. So let me explain a little bit about the history. So this patient had heel pain for 2 years. They had tried 2 cortisones from another doctor with traditional treatments like physical therapy. They were part of 2 Facebook groups. Then what they did is they found my YouTube videos and they said, hey, I'd like to see this guy. And oh, by the way, he's in Massachusetts where I'm at. And that was the key. The key was the YouTube videos. I have a number of YouTube videos on plantar fasciitis, and patients can sometimes identify with that. So what I did is she came in that same presentation I just showed you right here. If you go down to P, they're in alphabetical order, by the way. Patient plantar fasciitis, I pulled it up. I did the presentation for her. She had already watched it because she had already seen it on YouTube, right? And the results were, I did an ultrasound because it talks about ultrasound in the presentation. The other doc didn't have one. I did I don't think I did x-rays because she came in with the x-rays, which I usually do x-rays, weight-bearing x-rays. And so what I did is bilateral combo EPAT. So it would be radial and focused. The other doctor didn't have that to offer. They had only cortisone injections. And then for the right foot, it was more painful. On the ultrasound, it showed more effusion and thickness. And so on the right one, I did an amnio at the second EPAT. Okay, so usually it's at the second one I'll do it, and I set up a series. Now, she also had really, really bad plantar fasciitis for a long time, so I sent her for an Aero spring brace, which is like an AFO, and I sent her to hanger because she had Blue Cross Blue Shield, and I couldn't do that in-house. It would even be even better if I could have done it in-house. So that in and of itself, so, you know, financially, ultrasound, bilateral EPATs, doing the amnio, all those things, they kind of add up to around $4,000. So this was all from having one video online and then seeing that. So I would recommend the ideas for those listening, make your own videos. Okay. Put those videos on your website, put those videos on YouTube, and it's a benefit for patients and for you. Join maybe a plantar fasciitis Facebook group so you can get good ideas, and then get that video in front of more patients. So not only did I have her, she watched it before, I did the presentation and I sent her a copy afterwards, that page through Patient Education Genius. So I explain all this stuff within that 30-day practice blueprint if you don't know what I'm talking about with these things. Next thing is, this is funny. I have a patient, he's a vet. He's getting bilateral shockwave. He's having 6 sessions and he's almost finished, and he brought this in. I think he was a little in despair. And he said, well, if it's good for horses, it could be good for me. So management of hind limb proximal suspensory dermatopath by neurectomy of the deep branch of the lateral plantar nerve and plantar fasciotomy. So horses get it. He said, maybe I could use it if I'm not getting better with the shockwave. I said, be patient. You might not need it. Let's still do the current course. So this vet is doing that. This is a new addition to our EMR. So I did remove any patient identifiers from this. At least I hope I did. But this was the doctor's name. She's a vascular surgeon that saw it. But the neat thing is, within the medical record now, what I can see here is the vascular surgeon referral. And then I can also see all of the stuff popping in. So I referred over to this doctor, and I can, if I scan down, I can read the whole note. So it's really kind of a cool thing. I think this is going to be the future or present, so we can see what patients are seeing. Like right now, I can see all their notes from UMass, which is a big medical teaching hospital around here, if they're seeing them as their primary care. So that's kind of a neat idea, so we can see more and not have to have notes going back and forth. Right now, I still can't see the images because many times they have images, I just can't see them. So I want to end here. What are some things with my scribe? Now, I've been using my scribe for about a month now, and I'm really liking it. Not just because I'm lazy and I don't like to do notes, but most importantly, because my notes are better. They're done for me. And so it's making the harder notes easier. That's what I like. And I'm still having to review the notes and make little fixes in them, but it's making it so much easier. And it's working a little bit more with my workflow is changing a little bit, but I'm figuring it out. And so what's working is the notes are easier. It's taken about a month. So give yourself at least a month with your scribe. I use a lot of templates and macros. So it was already optimized how I did notes. But so I had to teach all those to the scribe. So when I have a fill-in scribe, they don't know how to do it because they don't know all the macros and templates. It makes my presentations a lot easier, so I can do just what I want to do, which is look at x-rays, talk to the patient, show a presentation, and then really connect with the patients without looking at my keyboard and typing. And I'm a quick typer, and I'm really quick. I just don't like to be distracted. They can also do prescriptions, LFT orders, like they can order cam boots, they can order Lamisil, they can order all these other things. They don't order narcotics. What's not working currently is they don't have access to something called Patient Education Genius, which is done within my medical record. They can't do that. They're not great at documenting images. So I try to, as I'm looking at the image, I'll talk through it, and they'll put in some of the high points, and they're not seeing what I'm seeing. So they can only hear. So I'd like to maybe get some of these glasses I know one of my buddies, he uses the glasses, and I think that's going to make things better. And like I said, the substitute isn't working. So anyway, those are the thoughts this week here within Podiatry Practice Mastery. Let me know what your thoughts, comment, and I hope you guys are enjoying this. Okay, until next time, thanks.